Hi friends, welcome back to my channel Mokambika Nursing. Friends, here we are discussing questions for RRB Nursing Officer exam preparation. In this video, we can see one set of previous year questions and answers. This is one of the Staff Nurse Grade 2 exam previous year question paper. We can see questions one by one. First question, structural and functional unit of liver is. Options, option A portal acinus, option B hepatic lobule, option C hepatocytes, option D Kupffer cells. Question, structural and functional unit of liver is hepatocytes. Option C is the correct answer. And the next question, myocyte with multiple nucleus is present in. Options, option A cardiac muscles, option B smooth muscles, option C skeletal muscles, option D myometrium muscles. Our question is myocytes with multiple nucleus. Myocytes means muscle cells. Muscle cells with multiple nucleus is present in skeletal muscles. Option C is the correct answer. Move on to the next question. Dentate nucleus is seen in. Options, option A cerebrum, option B cerebellum, option C midbrain, option D thalamus. And dentate nucleus is seen in cerebellum. Option B is the correct answer. On to the next question. Sternal angle levels with. Options, option A second thoracic vertebrae, option B disc between fourth and fifth thoracic vertebrate, option C disc between second and third thoracic vertebrate, option D disc between third and fourth thoracic vertebrate. Here the question is sternal angles is at which level? It is between disc between fourth and fifth thoracic vertebrate. Option B is the correct answer. Between fourth and fifth thoracic vertebrae. Move on to the next question. Which germ cells is seen in Graafian follicles? Options, option A secondary oocyte, option B primary oocyte, option C oogonium, option D membrane granulosa cells. The germ cells which is seen in Graafian follicles are secondary oocyte. Option A is the correct answer. And the next question. Scrotal temperature is regulated by. Options, option A destrusor muscle, option B tunica albuginea, option C tunica vaginalis, option D dartos muscle. Scrotal temperature is maintained by or regulated by dartos muscles. Option D is the correct answer. Move on to the next question. Werner's gland is found in. Options, option A duodenum, option B stomach, option C jejunum, and option D esophagus. Werner's gland are present in the submucosa of duodenum. Option A is the correct answer. Move on to the next question. The extreme hypothyroidism during fetal life result in. Options, option A myxedema, option B cretinism, option C Graves' disease, option D thyrotoxicosis. Extreme hypothyroidism in fetal lives result in cretinism. Option B is the correct answer. And the next question. The enzyme present in serous secretion of saliva is. Options, option A mucus, option B trypsin, option C chymotrypsin, option D thiolin. The enzyme present in serous secretion of saliva is thiolin. Option D is the correct answer. Next, 10th question. The normal intraocular pressure is. Options, option A 5 to 12 mmHg, option B 10 to 18 mmHg, option C 10 to 25 mmHg, option D 12 to 20 mmHg. Normal IOP is 10 to 21 mmHg. In our option 12 to 20 is there, so that is the correct answer. 12 to 20 mmHg. Move on to the next question. Which among the following is not a polyunsaturated fatty acid? Options. Option A linoleic acid, option B palmitoleic acid, option C linolenic acid, option D arachidonic acid. Which is not a polyunsaturated fatty acid? That is the question. So correct answer is option B palmitoleic acid. Move on to the next question. 12th question. Elevated plasma level of the following protects against atherosclerosis. Options, option A chylomicrons, option B VDL very low density lipoprotein, option C high density lipoprotein, option D low density lipoprotein. Our question is elevated level of serum. Which serum lipids level will protect against the atherosclerosis? And the correct answer is it is high density lipoprotein. Option C is the correct answer. Normal high density lipoprotein level is 30 to 70 milligram per deciliter. This high density lipoprotein level helps to protect against the risk of coronary artery diseases. Increased cholesterol level, then low density lipoprotein level and triglyceride level place the patient in for the development of coronary artery disease. But this high density lipoprotein helps to protect against atherosclerosis. And the next question, 13th question, serum amylase is raised in. Options: option A infective hepatitis, option B obstructive jaundice, option C acute pancreatitis, option D cancer of prostate. In which condition serum amylase level is elevated? And it is in acute pancreatitis. Option C is the correct answer. On with the next 14th question. Predominant buffer system of plasma is. Options: option A albumin, option B bicarbonate, option C hemoglobin, option D phosphate. The buffer system of plasma is contain bicarbonate. Option B is the correct answer. Move on to the next question. Insulin clearance is a measure of. Options: option A glomerular filtration rate, option B tubular secretion rate, option C tubular absorption rate, option D renal plasma flow rate. Insulin clearance is a measure of glomerular filtration rate. Option A is the correct answer. And the next question, which one of the following vitamin is synthesized by intestinal bacteria? Options: option A vitamin A, option B vitamin D, option C vitamin E, option D vitamin K. The vitamin which is synthesized by intestinal bacteria is vitamin K. Option D is the correct answer. Move on to the next 17th question. All are true regarding disinfection protocol except. Options: option A for non-critical devices decontamination is enough. Option B semi-critical devices are those which come in contact with mucous membrane. Option C for semi-critical devices low level disinfection is enough. Option D cardiac catheter is a critical device. Our question is, which statement is not correct regarding disinfection protocol? And the correct answer is option C. For semi-critical devices, low-level disinfection is enough. So all the device we have to disinfect. It is not low-level, high-level. Okay, so that is incorrect. For semi-critical devices, low-level disinfection is enough. That is incorrect or not true. Remaining all options are true regarding disinfection protocol. Move on to the next 18th question. In the first week of illness, typhoid can be best diagnosed by. Options: option A blood culture, option B feces culture, option C urine culture, option D viral test. Question is, typhoid can be best diagnosed during the first week of illness by blood culture. Option A is the correct answer. Move on to the next question. Which one of the following is used to monitor autoclave performance? Options: option A Bacillus cereus, option B Bacillus stearothermophilus, option C Clostridium perfringens, option D Clostridium tetani. Question is, which one of the following is used to monitor autoclave performance? And the correct answer is it is option B Bacillus stearothermophilus. Move on to the next question. An HIV infected patient is presented with chronic meningitis. Microscopy shows encapsulated yeast cells with budding in India ink preparation. Probable diagnosis is. Options: option A Aspergillus, option B Candida, option C Cryptococcus, option D Histoplasma. Question is, a HIV infected patient with chronic meningitis shows encapsulated yeast cells budding in India ink preparation. So what is the diagnosis? Which infection can occur for the patient? It is due to cryptococcal infection. Okay, option C is the correct answer. Move on to the next question. If there is delay in transport, which of the following specimen should not be refrigerated? Options: option A feces, option B pus, option C urine, option D cerebrospinal fluid. The specimen which should not be refrigerated is cerebrospinal fluid. Option D is the correct answer. Move on to the next question. All of the following are important infection control strategies in controlling spread of MRSA except. MRSA means methicillin resistant staphylococcus aureus infection. Except is the question. Options. Option A, aggressive hand hygiene. Option B, contact isolation of infected or colonized patient. Option C, routine antimicrobial prophylaxis for all hospitalized patients. Option D, routine surveillance for nasal colonization among high-risk patients. Our question is, which one is not an important factor for infection control strategies in controlling the spread of methicillin-resistant Staphylococcus aureus? And the correct answer is routine antimicrobial prophylaxis for all hospitalized patients. So we can't do prophylaxis for all hospitalized patients. Remaining all are the important infection control strategies of spread of MRSA infection. And the next question is, food rich in proteins are called. Options. Option A, energy yielding food. Option B, body building food. Option C, protecting food. Option D, regulating food. Proteins are body building food. Option B is the correct answer. Move on to the next question. The instrument which follows direct calorimetry is. Options. Option A, adiabatic calorimeter. Option B, Benedict Roth apparatus. Option C, comb calorimeter. Option D, Benedict's oxycalorimeter. And the correct answer is option C, Bohm calorimeter. Move on to the next question. During fever with 1 degree Fahrenheit increase in body temperature, the BMR changes by. Options. Option A, 7% increases. Option B, 7% decrease. Option C, 5% increase. Option D, 5% decrease. And the correct answer is BMR changes by 7% will increase. Option A is the correct answer. We are discussing the question and answers of previous year question papers. If it is useful for your studies, please share my videos to your friend circle.